Hello everyone, good evening. This is our part 2 for our new assessment form. Let's go. And first, we already identified in our part 1, we discussed the difference between the three new parameters, the pressure injury, moisture associated skin damage, and as well as your MARSI. Then here we are going to talk our general wound assessment. We're going to talk about all these things. Now let's go to your location. Now in your form, you're going to still put the X mark. Okay, X mark. In our surgical site marking, we are using the check and then encircle. But for our wound assessment form, we're still using the X mark. And we have three things also to write. First, you have the site. Site is what? The anatomical location of your wound. So it can be sacral, it can be shoulder, it can be foot or whatever. Then you have your side. Side is basically your left and your right. And then you have your surface, which is anterior, posterior, and lateral. This is very common for your upper extremities and your lower extremities. Then, let's go directly to your measurement. So measurements, you always have to remember these three things. These are the three basic things that we are going to measure, but there are also undermining and tunneling, which are not very common, but I'm just going to explain it a little bit for you here because still we are encountering this undermining and tunneling in our hospital. Okay, for the length, always measure the greatest length. Okay, not all the wounds are perfect circle. Not all the wounds are perfect circle. Some of the wounds looks like this. Correct? So if I am going to measure this one, we are following the clock system. Okay, 9-3. So my greatest length would be from here to here. And my greatest width would be from here to here. Okay, I hope you understand how we are going to measure the length and width. Again, the same principle. Not all our wounds has the same has the same shape, a perfect circle, a perfect shape. So if I'm going to measure, this will be my greatest length and this will be my greatest width. Now for your, okay, these are example of how they are going to measure your greatest length and your greatest width. Now your 12 o'clock is the direction of the, again, your 12 o'clock, 6 o'clock, 9, and your 3. 12 to 6 is this is the patient's head, this is the patient's toes, this is the right side, this is the left side. Okay, that is our guide in measuring. Now for this one, if I am to assume that this is a trochanteric area, so maybe this is the patient's head, right? So this will be my 12 o'clock and this will be my 6 and this will be my 9 and this will be my 3. I will assume that this is the patient's head. I'm not sure, but I will assume, okay? So my greatest length will be this one and my greatest width will be this one. Okay, now let's talk about the depth. Now the depth will be the deepest one. Okay? Sometimes the wound bed will be irregular in shape. It will be like here is very superficial, then suddenly here it's already depth, and then again it's very superficial here, like that. So you will measure your greatest depth. Now here in this picture, you are going to see the word undermining and tunneling. So what is undermining? Undermining is the separation of your wound from your skin. This is your skin. This is your wound bed. There is a gap between these two. That's why there is an undermining. You cannot see it if you're not going to place your hand around the wound lining. If you're not going to touch the linings of the wound, you will not know that there is an undermining because you cannot see it from the surface. Okay? And here, down here is what we call the tunneling. Tunneling is a burrowing. It digs deeper. It digs deeper on your wound bed. Okay, it digs deeper on your wound bed. That is tunneling. Here again, this is your undermining and this is your tunneling. Now for the measurement of your undermining, as you can see, there is a clock here. I integrate it with this one. This is undermining, correct? So the undermining is this black line from here. Now, your undermining starts from what o'clock? From 8 o'clock up until 2 o'clock. So this is your undermining. It's a big area. Okay? But for example, in this part here, it's just measuring 1 centimeter. Okay? And then here, 1 centimeter. Let's just assume. And here, it's already 3 centimeter around 1:30 o'clock. Okay. Now, when you are going to write it in your wound assessment form, o'clock will be 8 to 2, open close parenthesis, at 1 o'clock, 3 cm. Okay? Then, on the other side, sorry, I forgot to write the, again. 8 to 1, this is 1 cm, but you have to write here at 1 o'clock, it's already a 3 centimeter. It's complicated, I know, but this is the proper way to document an undermining. Okay? Anyway, if you encounter this one, I am here. You can always call me and I will do this for you. Then you have your tissue type. Now your tissue type is, we are just playing with the colors here. If you know the colors, then you know what it is. Now epithelialization. Epithelialization is a color pink or very, very bright pink, light red. If the wound appear like this, it means it's going for healing. The wound is for healing. Next, we have a very red one, a granulation tissue. A very nice. Granulation means it's highly vascularized. It's highly vascularized. That's why it's color red. So that is granulation. Now, we have here a slough. It's very common. You will see this in the wounds. These are dead tissues, but the colors are white or yellowish. Now, you know this one. This is necrotic, a black dead tissue on the wound bed. And this one, you have your red. Your red is only applicable for your stage what? Stage 1 pressure ulcer. Intact skin, non-blanchable redness. Then you have here your purple maroon color, which is your DTI. Okay, this is deep tissue injury. Clear? Then we have last two here. We have the eschar. The eschar is a dry, leathery black covering. So you will find this in a wound that is actually healing also. Okay, now for the others, you can write either there is a bone already, there are ligaments. Okay, because this is wound bed. Tayyib. These are all the wound bed of the patient. So you can write whatever you can see on the wound bed of the patient. Now here, you have to calculate it to 100%. You have to divide it. Okay? For example, this type of wound, if I am going to divide this one, I have two tissue types. Remember our tissue types, huh? From epithelialization, granulation, slough, necrotic, you have your red, you have your purple maroon, and you have your others. Okay, for this one, this portion here is my slough area. Okay? And this is my entire wound bed. So if I am going to calculate for this one, I am going to write what? I think I'm going to write 80% granulation and 20% slough. Okay? Then there will be a total of 100%. So that's how are you going to calculate. For example, this one, almost perfect in half. So I'm going to calculate, may give a score of 50 plus 50. So I have a total now of 100%. Now for this one, this is yellowish again. This is slough. So I will give it, how much? I will give it 70. I will give it 70% slough, and then I have a granulation, 20%, 30% granulation. So I have a total of 100%. Now this is based on your clinical judgment. So that's how we are going to calculate for your wound types. Now let's go for exudates. Exudates, we are speaking here two things. We have the type and then we have the amount. Now for the amount, there are three things. You have your large. The tissue is filled with fluid, and the exudates covers more than 75% of your bandage. Now for example, this is your wound dressing. Okay, this is your wound dressing. And while the dressing is attached to the skin, there are 75. This is soaked with your dressing is soaked with your wound exudates, discharges from your wound. Okay? Next, you have your what? You have your moderate. Now, moderate involves 25 to 75% of the bandage. Again, if your dressing looks like this, here it says 25 to 75%. So, most probably, okay, like this. Sorry. No, wait. That happened. Sorry, this one covers more than 75%, so it should be like this. Okay? Sorry guys. So the large should be like this, more than 75. Now for your moderate, it looks like this. Okay, let's leave a little bit there. And then you have your small, which covers 25% only of your dressing or your bandage. Okay? Now let's talk about your wound type. Now you have three types. First you have a serous. Serous is a clear, thin, and watery. This is like just almost like a water. You know, discharges like a water. Then you have your sanguinous. Sanguinous is watery. It's thin and watery. But why do you think it's pink? Pale red to pink color, because this is mixed with blood. Yes, this is mixed with blood. That's why we called it sanguinous. Okay? And you know what? Even before you open the wound, you will see it in the dressing itself. Now, the last one is you have your purulent. You know what is purulent? Purulent is thick, it's yellow, sometimes it's green or brown in color, but the characteristics of this exudates is thick. And this is a indicator of your wound infection. Now for odor. Let's talk about odor. Now, we have also three types. Now, foul. Foul, what happens is, when you enter the room, there is positive smell. Then, the dressing is intact. Okay? The dressing is still intact. You did not remove the dressing yet. But when you enter, the smell is already there. Now, for your mild, when you enter, okay, the smell, positive smell when you remove the dressing. Okay, when you remove the dressing, the smell, you can smell the wound. Now, for the nun, of course, even when you remove the dressing, you did not smell anything at all. Okay, that's odor. Next, we have your wound edge. Now, wound edge is your lining of your wound. Okay, this is the wound lining. We already talked about, again, remember, we already assess our wound, right? We assess our tissues. Your epithelialization, your necrotic, your slough. Now, when we talk about wound edge, you are checking this one. You are checking this line, the lining of the wound. Why we are checking this one? Because sometimes, most of the times, it will give us an indicator that there is something wrong with our wound. Okay, now, clear. What do you mean by clear? No open wound. So this is example only in what? Stage 1 and intact deep tissue pressure injury. Clear. That's how you are going to identify it as clear. Now for the attached sloping edge. Sliding. It's like a sliding. You know, slope. And no undermining. Remember the undermining? If this one is up until here. Anyway, wait. Okay. If your wound bed does not touch to your skin here, this is your undermining, remember? So when you say attach, it looks like this, you know? It's like a sliding, so you don't have undermining. That's how you are going to assess for an attached wound edge. Okay, non-attached, okay, with undermining. So you know already. Here, your wound bed is not attached to your patient's skin. Okay? Now we have rolled edge. Rolled edge is a wound that appears curled under. Okay? It's curled under. Example of this is this one. You can see? It's like going inside. Sa? Curled under. So this is not an indication of a healthy wound. Why we don't like this? It will delay a wound healing. And this one also. You see this side? It's look like a pizza. This is the one I can explain it. Okay, epithelialization, it's a pink or new. Okay? This is common and very superficial, like the stage 2 wound. This is actually you can only find it in the stage 2 wound. They are very superficial. Your wound edge are color pink. So like this. Okay? Like this. Like this also. So these are your example of your epithelialization wound edge. Now, okay, back again. I'll make my drawing. So this is your wound. We assess the wound bed, necrotic, slough, whatever. Okay? Granulation, then we assess your wound edge, rolled edge, attached, non-attached. Okay? Whatever it is. Now we're going to assess peri-wound. Ma'am, question, what is peri-wound? Peri-wound is the surrounding of your wound. Okay? The outside surface of your wound. That is your peri-wound. Okay? Now, first, we have normal and intact. Normal and intact, you did not see anything at all. Everything is clear. The color of the patient's skin surrounding the wound is the same. Erythema is what? Erythema is redness. Now, if you're going to see any redness on the area, what will it tell you? It will tell you that there is a signs of infection. Okay? Inflammation. Now, edematous, this is soft. Indurated is hard. Okay? Now, edematous in accumulation of serous or fluids or water. That's why if we're going to assess a patient with edema, we're going to press it and then we are going to grade it, correct? That's what is edematous means. Indurated also, it's a swelling. Indurated happens for patients who there is an IV infiltration. Okay? In your IV infiltration, you will observe that the patient's hand, it's like actually like bursting out. It's very tight on the skin and you cannot actually press it because the hand of the patient are very hard. So that is an example of your induration. It's you can also find it in the patient's wound. Okay? Now, maceration and callus, they are both the same. The characteristics is white to very light yellow. But yellow, most probably it will happen on a callus skin. But what happens here, maceration is wet, callus is dry. Again, you remember when I discussed moisture associated, this is a maceration. The surrounding tissue is wet, okay, because of the discharges of your wound. That is very wound, moisture associated dermatitis. So if this happens, we want to pack our wound with dressing. Now for callus, it's dry and the same color, it's yellow. Again, remember on the surrounding of the patient's wound. We are talking now surrounding the patient's wound. Fragile, you know what is fragile. You know what is fragile. Now, excoriated is like a superficial loss of tissue. Okay, a superficial loss of tissue. Like, not skin stripping, but this one, there's an already open wound for this one. Okay, then for the remarks, you have your different remarks. You have healing and healed. You have transferred, refused, discharge, refuse treatment, and discharge. Okay, and that's all for your wound assessment form. Again, if you have any question, please don't hesitate to tell me and contact me. My duty will always be 8 to 5 every day. Thank you.